there is an increased risk of suicide after a brain injury. And I think the last thing I read, and it was from Brain Injury of America, which you folks can check out, which has a lot of this information I'm sharing too. And I said that so that your listeners could have that resource. They did talk about the 1 in 5 brain injury survivors that admitted to having either attempted suicide or suicidal ideation, and that it was up to 5 years after the brain injury. You have to really be careful with your words, and because they will stick, just like a child, it will stick in their brain the rest of their life, and to monitor for those symptoms of suicide, even up to 5 years. So it's definitely a risk to be aware of.
Yes, it's definitely something that also is not talked about. It's not discussed when you leave the hospital. It's not something that you're made aware of, that this could be a truly dangerous outcome from a brain injury. And if you're not aware of depression, if you're not aware of anxiety, sometimes they're really delicate changes that you can see. If you're not paying attention, they can be missed. And I think the other thing is being heard. They need to feel heard. And
Yeah.
that adds to that complexity. I 100% believe that those stats are very accurate because it's something that we experience and we were not prepared for it. We weren't aware of it. And because of my caring role, I'm acutely aware of the changes, the small changes. And the scary thing is what if I'd missed it? What if I hadn't seen it and been like, hey, I'm noticing that you're really struggling in this space. Do you want someone to talk to? Do we need to give you somebody outside this space a platform? Because sometimes they need that. They need an outside person to be able to express these things and feel confident in then coming back and communicating these things. And you're right. Words do damage. We have to be compassionate. We have to be conscious of how we're interacting and the things that are said. And we have to be present in those moments so that they can see that that's a path they don't need to take, that they have the support, they have the love. And sometimes when depression and anxiety become a reality in this space, people feel ashamed. People feel like they can't tell people because they'll just be dismissed, or they'll be told you're fine. You're just having a moment where it's more than a moment for them. It's more than just a fleeting thought. As you were saying, the rumination of the negativity and the nastiness, the self-put-downs, that was something that changed and was very loud. And if you're not paying attention to it, you just think about it as they're having a bad moment. That healing is part of the journey. Us as family members, us as caregivers, is holding space. And sometimes that space is just being present, holding their hand. I hear the term body doubling for neurospicy individuals to help them to be able to accomplish sometimes simple tasks. And that is what it's like for us in this space as caregivers of people with a brain injury. Sometimes they just need somebody there. They can do the task, but it's overwhelming. And just having you stand there and talk to them about anything else helps them to accomplish it and then feel empowered in themselves that they actually still can achieve these things. And you mentioned that part of your work is now sharing the coping strategies and the tools that helped you, and that you see helping your patients, especially those who still need to work, study, or parent while healing. So let's talk about what's actually doable for people living in this middle area of recovery.